Hypertension is when the force of blood against the artery wall is high enough that it may cause health problems, such as heart disease. In fact, it's estimated that up to 26% of the world's population suffer from hypertension, and this number is growing. In specific countries such as the United States, this number is even higher at over 47%. In this video, I'm going to share what hypertension is and the effect it has on the body. Secondly, I'm going to share 10 lifestyle steps that can help lower blood pressure naturally. Just a reminder, this is not individual medical advice. Talk to your doctor or health professional before applying any of these 10 lifestyle steps. So, what is hypertension? Firstly, there are two main types of hypertension. The first type is called primary hypertension. This is actually the most common type, causing up to 95% of all cases of hypertension. Another name for this is called idiopathic hypertension, meaning that the cause is unknown. The other type of hypertension is secondary hypertension, and this is when there's an actual known disease influencing blood pressure, such as kidney problems. The top number measures the pressure in the arteries when the heart beats to push blood into the body. The second number measures the pressure in the arteries between beats. This is also known as the relaxation phase, where the heart muscle can feed itself. Generally speaking, below 120/80 is considered optimal. 120/80 to 129/84 is considered normal. 130/85 to 139/89 is considered high to normal. 140/90 to 159/99 is considered mild hypertension. 160/100 to 179/109 is considered moderate hypertension. Anything over 180/110 is considered severe hypertension. When looking at blood pressure, it's also important to measure the point difference between the systolic and diastolic pressures, or the top and bottom numbers. This is also called pulse pressure. Now, this is really important because the wider the number is, the greater the risk of heart disease. The optimal range is having a 40-point difference between the top and the bottom number. However, a meta-analysis in the year 2000 combined the results of studies of 8,000 elderly patients. They found that a 10 mm of mercury increase in pulse pressure increased the risks of major cardiovascular complications and mortality by up to 20%. And a pulse pressure of more than 70 mm of mercury can put patients at risk of a cardiovascular event. It's also important to note that when diagnosing high blood pressure, the diagnosis should be based on multiple blood pressure measurements on separate occasions. So, what are the risks of high blood pressure? Well, firstly, high blood pressure can be silent, meaning that you may not even notice that you have high blood pressure. In fact, high blood pressure can be silently damaging the body for years before anything is even felt. Left uncontrolled, high blood pressure can increase the risk of heart attack and stroke. It's estimated that up to 50% of people with uncontrolled hypertension die of heart disease related to poor blood flow, and 1/3 die of stroke. High blood pressure increases the risk of stroke because the higher pressure damages and weakens blood vessels through the brain, causing them to narrow, rupture, or leak. Additionally, as the heart pumps harder, over time it also may damage blood vessels surrounding the heart. In response, the walls of the heart may become thick and enlarged, causing hypertrophy or an enlarged heart. These are not the only risks. For example, the following is a list of some complications from uncontrolled high blood pressure, including damage to arteries, narrowing of arteries, aneurysm, coronary artery disease, enlarged left side of the heart failure, stroke, dementia, cognitive impairment, kidney failure, kidney scarring, eye blood vessel damage, nerve damage, sexual dysfunction in men and women, and obstructive sleep apnea. So you might be wondering, what are the 10 lifestyle steps that we can take to support lowering blood pressure naturally? The first step is increasing potassium-rich foods. Potassium-rich foods can help balance the effect of sodium and lessen its effect on blood pressure. Number 2, beetroot juice. It's been shown that consuming beetroot juice daily can reduce blood pressure by up to 5 to 10 points. It's been proposed that it can do this due to its high concentration of nitric oxide. Nitric oxide can help relax blood vessels and dilate them. Number 3, weight loss. Blood pressure can increase as weight increases, And carrying excess weight can cause breathing problems while you sleep, which can increase blood pressure even further. So naturally, losing weight can support lowering blood pressure. Number 4, resolving distress. Resolving distress is important because as we get very stressed, it raises the activity of the sympathetic nervous system, and a natural byproduct of that is increased blood pressure. Now, finding ways to deal with distress is very important. A few ways could be meditation, an important tool called the DEMARTINI method, which can help resolve anxieties, depressions, resentments, and griefs, and any stresses that pop up in our life. You can use other strategies such as Chinese medicine or acupuncture, which can help release the body's own endorphins and feel-good hormones. Number 5, isometric exercises of the forearm. This is very interesting because there was a study in Australia that showed that isometric exercise of the forearm, such as gripping an object strongly with the forearm up to 3 times a day for 8 weeks, showed a 7-point reduction in the patient's blood pressure. It's been proposed that the contraction and the squeezing of blood vessels is helpful because as the muscles relax, as does the blood pressure. Number 6, eliminating sugary processed drinks. In fact, a high sugar diet in general is a recipe for disaster because it's going to speed up the aging process as it negatively affects the blood vessels and the body's vascular system, potentially creating stiffness and aging of blood vessels. And stiff blood vessels increases blood pressure. Not only this, but sugary drinks will spike insulin. High levels of insulin can increase blood pressure. Number 7 is reducing salt intake. The idea is that sodium and water follow each other. If we have a high salt diet, our body will also retain more water. And with more retained water, we will increase our blood pressure. Number 8 is reducing or quitting cigarette smoking. Quitting can help reduce blood pressure back to normal and reduce the risk of heart disease. Number 9, reducing caffeine. Caffeine itself can raise blood pressure by up to 10 points in people that don't have it very often. And number 10, consuming aged garlic. In a study with 210 people over 24 weeks, aged garlic showed to be as effective as a atenolol for hypertension. More specifically, the phytonutrient called allicin contained in aged garlic showed anti-hypertensive effects. How? Because it can help relax blood vessels and reduce hypertension, but also it helps increase nitric oxide, which can also help hypertension, similar to beetroot juice. Aged garlic also showed to have anti-inflammatory effects and even the ability to thin the blood and reducing the chances of clotting. It's important to know that aged garlic can work better than fresh garlic. So there you have it. That's 10 lifestyle steps that we can take to support lowering blood pressure with oversight of your doctor. If you really like this video, watch my video on how I use Chinese herbal medicine to support patients with their high blood pressure. If you really like this video, please give me a big thumbs up. And if you'd like to see more content like this, please subscribe to my channel. Thanks for listening, be grateful and take care.